A very good afternoon to everyone who have come to join us this Saturday afternoon to learn a bit more about a condition that is very close to my heart. I'm a geriatrician and have a special interest in the care of the elderly person with dementia. I'm not sure how many in this room know someone with dementia, but as our country's population continues to age, we should all have some understanding of this condition, which will become increasingly common. And at some point in time, we probably would eventually get to come into contact with someone with dementia. So in today's sharing, I will be bringing you through what dementia is, how it is diagnosed, some of the types of dementia, how it is treated, how we can prevent dementia. And the last part will be trying to answer some of the frequently asked questions and debunking the common myths about dementia. So what exactly is dementia? It is a group of symptoms in which there is a decline in memory, thinking, behavior, and or social abilities that are severe enough to interfere with independence in daily activities. Different types of diseases can lead to dementia. What is it not? It is not part of the natural aging process, but is always due to a disease. So while it is common to see dementia in the older person, it is not part of the normal process of aging. Forgetfulness is usually the most prominent symptom, although abilities to reason and judge are often impaired as well. With progression, the people with dementia will find it increasingly difficult to care for themselves. Here I share with you some statistics on dementia, and you will see why dementia is going to be an increasingly important condition for us to know about. Based on World Health Organization statistics, around 50 million people have dementia worldwide. 10 million new cases are being diagnosed every year, and it is a major cause of disability and dependency among older people worldwide. It is projected that the number of people diagnosed with dementia will reach 150 million in 2050. What about locally in Singapore? Among those more than 65 years old, 5% have dementia. According to Dementia Asia Pacific 2010, about 53,000 Singaporeans are estimated to be suffering from dementia in 2020. Figure is estimated to rise to 187,000 in 2050. With increasing age, the possibility of suffering from dementia increases. As you can see, in the early 60s, less than 2% have dementia, and this rises up to 1 in 3 when we reach 80 to 90 years old. Next, I'll move on to talk about what are the symptoms of dementia. I will share with you some of the more common ones. Bear in mind that each person presents with dementia differently, and you don't need to have all these symptoms to have dementia. This is a very nice summary slide on the 10 warning signs of dementia. These include memory loss, difficulty performing familiar tasks, problem with language, disorientation to time and place, poor or decreased judgment, problems keeping track of things, misplacing items, changes in mood and behavior, challenges understanding visual and spatial information, and withdrawal from work or social activities. If these signs are new, they may be a sign of dementia. I will go into greater detail for some of these symptoms. So firstly, we have memory loss, which is usually the most common symptom. It usually starts with recent memory first before long-term memory is affected. You'll find that people may be repetitive, asking the same question over and over again, or saying the same story again and again. They may forget that they had their meals or what they had eaten, or recent conversations that had taken place, for example, just earlier in the day or last week. They tend to lose the items and are not able to find them independently. While it can be normal to forget appointments and telephone numbers occasionally, I'm sure some of us have experienced it, but in people with dementia, they tend to forget these things much more often and will be unlikely to remember them even after much effort. Disorientation to time and place. People with dementia may regularly lose track of the year, month, day of the week, and in the severe stage, they may even mix up the day and night. They may lose their way in familiar surroundings, and may even forget their way back home. In the severe stage, they may not even be able to recognize their own home. People with dementia find it difficult to complete everyday tasks and need help with them. We are referring to the instrumental and the basic activities of daily living. Instrumental activities of daily living require a higher cognitive function, and these are some of the things like shopping, organizing household chores, accounting or performing bank transactions, preparing food, taking the public transport, taking medications, and making telephone calls. Basic activities of daily living refer to dressing, eating, walking, transferring, going to the toilet, and showering. Next, language problems are common in dementia as well. They may have problems trying to find the right word to express themselves or have difficulty in understanding simple speech. For example, they may say something vague like, I want to go there to do this. What they're really trying to say is they want to go to the bedroom to sleep, but they have lost the words to try and express themselves. Or they could say, can you please help me take that thing? But actually they're referring to money. But again, they have difficulty finding the term that they want to use. They can also have problems with planning and judgment. For example, you may notice that they're overstocking the refrigerator with too much of the same food because they can no longer keep track on what it is that they need to cook or what they have at home. They may be spending large sums of money when salespeople try to sell them items or packages. They also have difficulty organizing household chores, and the house may become increasingly messy and disorganized. Some people with dementia have problems recognizing people who are familiar to them. They may also have problems with spatial relationships and get into more road traffic accidents during driving because they have problems with judging distance and speed. Very often, they also have changes in mood and behavior, where they may experience mood swings from being very calm in one moment and being angry and in tears the next moment for no clear reason or for a reason that's very, very trivial. They may become very irritable or agitated when told that they are wrong. What we very commonly see is the development of this symptom where they become very suspicious of people. And when they misplace the items because they couldn't remember where they placed them, they very quickly accuse the people around them of trying to steal the items. And it can become very difficult for the family members living with them. And lastly, withdrawal from work or social activities. People with dementia tend to become very passive and lose interest in the hobbies or activities which they previously enjoyed, frequently because these activities have become too complicated for them to do. For example, someone may enjoy gardening or sewing, and after a while you find that, how come they're no longer doing that anymore? It's because it could be a symptom of dementia because these things need a lot of planning and organizational skills, and it simply has become too difficult for them to handle. So instead, they tend to gravitate towards very passive activities like sleeping all day or watching the television. How then is dementia diagnosed? Doctors use the DSM criteria to make a diagnosis of dementia, and a person needs to fulfill all three criteria in order to be diagnosed with dementia. Firstly, there needs to be an evidence of cognitive decline from a previous level of performance. This means that we need to see a new deterioration in a person's capabilities. For example, if someone always had poor direction sense and gets lost whenever he or she drives, we don't consider that a symptom of dementia. However, let's say we have a taxi driver who had a very sharp sense of direction, but has now started to lose his way, making multiple detours and even failing to send his passengers to the correct destination. That would be very concerning and possibly a symptom of dementia. Second criteria is where the cognitive impairment interferes with independence in everyday activities. This means that the problem needs to be severe enough such that we are no longer able to perform some of the everyday activities on our own. As mentioned earlier, the instrumental activities as well as the basic activities of daily living. And lastly, we need to be sure that the cognitive symptoms are not due to another disorder For example, delirium, which is an acute or sudden confused state, usually due to a medical illness, depression, or schizophrenia, a mental disorder. What should you do then if you think someone may have dementia? Well, bring them to seek medical attention. A doctor's consult would usually include history taking, where information is gathered, physical examination, a brief mental test, and investigations such as blood tests and brain imaging before a diagnosis will be arrived at. If you should have someone you're concerned may have dementia and would like to bring that person to see a doctor, try to ensure that the accompanying person is the one who knows the patient best, so that he or she may provide as much details as possible that is crucial in the diagnosis of dementia. We move on to the types of dementia. There are actually many different types of dementia. As shown in this pie chart, the most common type of dementia is Alzheimer's dementia, causing 60 to 70% of all dementias, followed by vascular dementia, causing 20 to 30% of the cases. There are other less common ones like Lewy body and frontotemporal dementia, as well as other rarer causes. But I think what is important for us to all know about would be Alzheimer's and vascular dementia, as they are the most common ones. Sometimes a person may have more than one cause of dementia, and we will then say that they have mixed dementia. Very often, Alzheimer's and vascular dementia can happen within the same person. So here are some of the common terms you may have heard before. Alzheimer's disease, Alzheimer's dementia, and dementia. Are they the same thing? So just to clarify, Alzheimer's disease is the most common cause of dementia, and it leads to Alzheimer's dementia. Stroke is the second most cause of dementia, and it leads to vascular dementia. So while Alzheimer's is the most common cause, not all dementia is Alzheimer's. So I will now dive a little deeper into the different types of dementia, starting with Alzheimer's dementia. As mentioned earlier, Alzheimer's dementia is the most common type of dementia. People with Alzheimer's most commonly have prominent memory problems, especially starting with recent events. They may also have problems with language, visual spatial skills, and in the late stage, they tend to have behavior problems like agitation or irritability or sleep problems. The distinguishing feature in Alzheimer's dementia is the presence of abnormal proteins called beta amyloid and tau that build up in the brain. No one really knows why this happens, who is more at risk of it. At the moment, research is still ongoing, but we still don't know that. On the brain scan in Alzheimer's dementia, we tend to see shrinkage in the region of the hippocampus, which is the memory center of the brain. As you can see in the picture on the slide, it shows the cross-section of the brain. On the left, we have the normal brain, which is fuller as compared to the abnormal brain on the right in Alzheimer's dementia. As you can see, it is shrunken and smaller, especially in the area circled in red, which is the memory center of the brain. This graph shows the decline in cognitive and functional performance over time as we progress through the stages of Alzheimer's dementia. As we can see by the slope of the graph, we expect a slow, gradual decline over 8 to 12 years from the onset of symptoms. Moving on to vascular dementia, the second most common cause of dementia. It is caused by reduced blood supply to the brain due to damaged blood vessels, depriving brain cells of oxygen and nutrients. People with history of heart attack, atrial fibrillation, or irregular heartbeat, high cholesterol, high blood pressure, diabetes, obesity, and smoking are at increased risk. People with vascular dementia tend to have problems with planning and judgment, language, control of their emotions, as well as behavior problems. They tend to have less of the memory problems that a person with Alzheimer's may have. The history and physical examination coupled with the brain scan which shows evidence of stroke in the area of the brain important for cognitive function will lead us to a diagnosis of vascular dementia. While people with Alzheimer's dementia gradually deteriorate over time, Those with vascular dementia tend to have what we call stepwise decline, where there are sudden sharp declines in their cognitive function. This picture here shows the possible types of progression in vascular dementia. The line numbered 1 represents a patient who had suffered one single stroke, affecting the region of the brain important for cognitive function, leading to vascular dementia. Immediately after the stroke, there may be some recovery, but they're not as good as before. Line number 3 shows a patient who had unfortunately suffered multiple strokes and therefore multiple sharp declines in their cognition. And line number 2 shows a more gradual kind of decline, almost similar to Alzheimer's dementia, where the patient has disruption in the blood flow to the very small blood vessels in the brain, such that there is slow accumulation of brain damage over time, causing gradual impairment. So in summary, Alzheimer's dementia tends to progress very, very slowly over many years, whereas for vascular dementia, they may present very suddenly, or it can also present gradually. Moving on to a less common form of dementia, Lewy body dementia. The distinguishing feature in this disease is that of an abnormal protein called Lewy bodies. They build up in the brain and lead to brain degeneration in this disorder. Patients with Lewy body dementia have a unique set of features, including fluctuating alertness, visual hallucinations, a movement disorder similar to Parkinson's, where they are stiff, slow, and shuffle when they walk. They are very prone to falls, as well as REM sleep disorder. Visual hallucinations in this condition is where they can see images of things that are not there, and they can usually describe these images in great detail. For example, they can say that they see a child running around, or they may see a woman with long hair wearing a red dress. For REM sleep disorder, this is when during sleep, they act out their dreams and may be shouting or moving about, and this tends to be very disruptive and may even sometimes hurt their bed partner. In terms of cognitive deficits, people with Lewy body dementia tend to have difficulties with problem solving, planning, and visual spatial abilities. Next, we have frontotemporal dementia, again another less common form of dementia. People with frontotemporal dementia commonly have changes in personality or behavior, language problems, and difficulty with planning. Behavior problems include apathy, where they lose interest in the things that are happening around them or lose motivation to do anything at all. They also lose sympathy and empathy, leading to socially inappropriate behavior and easily offending others. They can have ritualistic behavior, where they are inflexible and need to do certain things in a certain order. If not, they get very upset and they cannot move on. This condition tends to occur at a younger age, in someone who is in their 50s to 60s, as compared to the other types of dementia. And is therefore usually much more devastating and disruptive, because people in a younger age tend to still be working and supporting their families. As you can see in a brain scan of a person with frontotemporal dementia, there is shrinkage in the frontal and temporal region of the brain, which is just the area behind the forehead and the side of the head. The last slide lists the other less common causes of dementia, including Parkinson's disease, HIV, alcohol, Huntington's, and CJD, which I will not be going into detail today. Here is a summary table of the 4 common types of dementia. I will not be going through them again, but mainly you can see that the different types of dementia differ in terms of the onset and progression, the signs and symptoms that the person will have, as well as what we see on the brain imaging. So these put together help us make a diagnosis of the type of dementia. Why is it even important to know the type of dementia? Is it not all the same? Well, the progression is different, and this allows us to anticipate and plan ahead. The use of medications differ depending on the type of dementia as well. The associated symptoms and problems, and therefore the needs of the person with dementia and their caregivers are different. This allows us to tailor treatment accordingly. Stages of dementia. So at the point of diagnosing dementia, we would usually stage the severity of the dementia as mild, moderate, or severe. In the mild stage, The person is still able to live independently with adequate personal hygiene preserved. This means that they are still able to dress themselves, feed themselves, use the toilet, bathe, and walk on their own without help or reminders. In general, in the mild stage of dementia, their loved ones would still feel safe to leave the person at home alone in a familiar environment. At the other end of the spectrum, in the severe stage, continuous supervision is required and they are not able to maintain minimum personal hygiene if left on their own. At this stage, they are heavily dependent on their caregivers for everyday activities. They will need help with showering, cleaning up themselves after going to the bathroom, and may even have difficulties feeding themselves properly. Moderate stage is anywhere in between, where they are still somewhat able to care for themselves, but with some help. The life expectancy of a patient newly diagnosed with dementia may vary depending on the events precipitating a diagnosis. The life expectancy is unpredictable, and the disease can progress for up to 10 to 12 years. Although dementia is a life-shortening illness, another condition or illness such as pneumonia may trigger death. So how do we manage somebody with dementia? Just as it takes a village to raise a child, it also takes a village to care for a person with dementia. We need to take on a multidisciplinary approach, which means many members forming a team to care for someone with dementia. And this usually involves a doctor, a dementia specialist, nurse or specially trained nurse in dementia. Can also include the psychologist, occupational or physiotherapist, the dietitian, speech therapist, pharmacist, or medical social worker. Most importantly, it involves the caregiver, the one who is going to be taking care of the patient. Here are the main pillars of dementia management. First, we need to identify and treat the cognitive, mood, and behavior symptoms via a combination of medication, and lifestyle strategies to slow the progression and manage the behavior or mood symptoms. Next, we need to ensure the person with dementia is engaged with adequate physical and mental stimulation. We need to develop a routine for them as they would have lost the ability to plan their day. If left to their own, they would simply turn to lying in bed or mindlessly sitting in front of the television. Securing their safety is a priority, and this involves addressing things like fire hazard, driving safety, and falls risks. We need to assess and manage impairments in activities of daily living. For example, if they have difficulties with walking, do they need a walking aid? If they have difficulties standing during showering, do they need a commode chair so they can be seated during shower time? Caregiver support is something we have realized to be very important in the care of a person with dementia. This involves counseling to provide them with the knowledge on the disease and skills to care for the person with dementia. We need to teach them how to adjust the communication styles, and this can be done in training and workshops that are available. Lastly, we need to plan ahead where possible. In early stages of dementia, when they're still able to make decisions, we encourage them to make a lasting power of attorney to appoint someone to help take care of their affairs should they eventually lose the ability to do so. We also encourage them to engage in advanced care plan discussion regarding their preferences in terms of how they want to be cared for in the event of illness. The key to dementia care is really what we call person-centered care. We need to ask ourselves, who is this person, in order to be able to deliver good care, because every person with dementia is unique. What works for one would probably not work for another person. Only by knowing the life history in terms of the family setup, education, or previous occupational history, the health conditions, what medical problems do they have, what are the functional abilities, their personality, lifestyle, belief systems, and support system, basically what matters to this person. And lastly, the support system, who are their caregivers, who are their next of kin. Then can we know what is going to be helpful and practical for the person in front of us. Some may be interested to know more about medications in dementia. There are mainly two types of medication, the acetylcholine esterase inhibitors and the NMDA receptor antagonists. For the first type of medication, some examples are donepezil, rivastigmine, and the common side effects are nausea, vomiting, diarrhea, and slow heart rate. For the second type, an example is memantine, and the side effects are headache, transient confusion, and higher risk of seizure. Both types of medication have been proven to delay the progression of symptoms in some patients with Alzheimer's and vascular dementia. I would like to stress that response is very variable. It works in some but does not work for others. The doctor will discuss and advise if medications are appropriate. As you can see in my previous slide, there are really multiple facets in dementia care, and medications form only a very small portion. Note that medications cannot stop the progression of dementia, and at the moment there is no available cure, although a lot of research is ongoing. You can think of it as medications helping to turn back the clock, but time continues to move on. Now that we know dementia is an incurable condition, are there ways we can prevent it? When thinking about dementia prevention, it is important to look at what are the factors that place us at greater risk of dementia in the first place. These include factors that are non-modifiable that we cannot do anything about, such as increasing age and family history of dementia. There are many other factors that we can potentially do something about, such as low education, hearing loss, traumatic brain injury, cardiovascular risk factors like diabetes, high cholesterol, high blood pressure, heart disease, stroke and obesity, smoking and excess alcohol use, depression, social isolation, and air pollution. The diagram on the right shows us the changeable risk factors for dementia and the corresponding percentage reduction in dementia if the risk factor is successfully eliminated. As we can see in the red circle, if we can do away with all these known risk factors, we can potentially reduce the risk of dementia by 40%. So by targeting the known risk factors of dementia, here are the dementia prevention strategies. First, adopt a brain-healthy diet. We encourage a balanced diet with adequate fruits and vegetables, fish high in omega-3 such as salmon and mackerel. We should quit smoking and also restrict alcohol intake. It is very important, and everyone can do this, which is to keep active physically, socially, and mentally. We advise that you exercise up to 5 times a week, 30 minutes each time. But, just start slow and gradually increase. If you've never exercised before, just give yourself a target of once a week, and you can gradually increase it by frequency and the duration of the exercise. We advise you to grow your relationships with family and friends. You can join community activities and even possibly consider volunteer work, because keeping socially engaged is important in preventing dementia. Control your medical conditions. If, let's say, you have diabetes, high blood pressure, and high cholesterol, see your doctor and make sure that these are well controlled. If you have hearing impairment, get assessment done to see if anything can be done to reverse it, or whether you can be fitted with a hearing aid to help you hear better. And lastly, if you have depression, seek treatment for it. Here are some of the ways to keep our mind active. We can learn something new. Sign up for an art or language class or computer skills class. Challenge your mind with games. Keep your mind active with things like mahjong, sudoku, word games, jigsaw puzzles, whatever interests you. And if you can get your friends to engage in these games with you, that's even better. Practicing meditation and mindfulness, that has been shown to help improve attention and helpful in memory. And lastly, keep up to date with news via newspapers or news radio. In the last section of my talk, I'll be answering some of the frequently asked questions and debunking common myths. During this time, please feel free to ask questions in the chat box, and I will try my best to answer them at the end of the talk. So firstly, why is it important to diagnose dementia early? If a disease is determined in the early stages of dementia, lifestyle changes and medications can be given to reduce the symptoms of disease and improve the person's ability to function in their daily activities. Doctors can also give other advice and medication to treat disorders of mood or behavior problems commonly seen in dementia. Dementia nurses can teach family members how to care for and deal with behavior problems in dementia patients so that caregivers don't have to feel alone and helpless. When still in the early stage, the person with dementia can be involved with planning for the future, and this is very important. See your doctor as soon as possible if you think there might be symptoms of dementia. Is it true that only the old can get dementia? No. Although dementia is more common in those older than 65 years old, it can affect younger people as well, a person of any age. If a family member has dementia, will I get it too? Although dementia is an illness that can be inherited, less than 5% of cases of dementia are influenced by genes. The chance increases when the onset of dementia in a family member happened under the age of 60. When a family member is diagnosed with dementia after 60 years old, the role of genes is less clear. So are these supplements helpful? Vitamin E, ginkgo, omega-3, etc. Some people buy them over the counter to help with memory, but to be honest, there's actually no real evidence for these supplements to be beneficial in reducing risk of dementia, and therefore we do not routinely recommend it. Next, what are some of the myths of dementia? People with dementia are just trying to be lazy when they refuse to do the things they usually were able to do. They are trying to make things difficult on purpose. Actually, in reality, everyday activities that seem simple, easy, straightforward for us can be very complicated for the person with dementia. They are not able to perform them because of deterioration in their brain function due to the disease and not by their choice. Behavior symptoms are usually due to an unmet need that they have but are unable to convey due to the underlying disease. For example, a person with dementia may not know how to keep themselves engaged in a day. A normal person usually, for example, we work, we do housework in the day, and therefore at night we're adequately tired and we sleep well. But a person with dementia may not know how to plan their day, and because they are not well engaged in the day, they may sleep poorly, and you may think that they are trying to cause problems by not sleeping well at night, but that's not true. So there's an unmet need where they are not sufficiently engaged in the daytime. A second common myth, dementia is an aging process that cannot be avoided. So this is not true. As mentioned earlier, dementia is a disease. It is not part of the normal aging process. While very common in the elderly, it does not happen in all people who are old. For example, an autopsy of a woman aged 115 years had shown that the brain did not show effects of dementia. So it does not happen to every single person who is old. Myth number 3, if someone is suffering from dementia, nothing more can be done. So although dementia is a disease that cannot be cured, there is a combination of lifestyle changes and dementia drugs that can slow down the progression of dementia. There are a variety of medications and also ways and strategies to deal with the symptoms of dementia. So I'll then move on to share some of the resources for dementia. There are actually a variety of resources to support patients and their caregivers with dementia in the community. Speak to your doctor to link you up with these services as appropriate. This could include post-diagnostic support where caregivers are given counseling upon the diagnosis of dementia by the doctor. There can be home-based interventions where a team can visit the caregiver and patient at home to help with managing any problems they are facing in caring for the person with dementia. There are a lot of support for caregivers in terms of support groups and training workshops available, and as well as talks to attend. For the person with dementia, if the caregivers have difficulty caring for them, there are daycares specialized in taking care of dementia, as well as nursing homes in caring for people with dementia. I would like to share that a person with dementia, ultimately it would be best if they can age at home, where it is a familiar place for them where possible. Of course, it depends on whether the family members are able to have enough resources to care for them at home. We do try to avoid sending them to nursing homes, but sometimes it's not possible. If let's say you would like to find more resources, please go online, look up for, search for Dementia Hub Singapore. There is a lot of rich resources for dementia in terms of information or services to provide help and support for the caregivers. This has been put together by Dementia Singapore and AIC, the Agency for Integrated Care. They also have a dementia helpline that you can call. So the last part is a summary. So here are some of take-home points from today's sharing. So with the aging population in Singapore, the number of people who will suffer from dementia will increase. Although at present there is no medication that can cure dementia, there are lifestyle changes and medications that can slow down its progression and manage behavior or mood symptoms. Dementia not only affects the patient, but it can also affect the people around the patient, especially the caregivers. There is help available and we only need to seek for it. I leave you with this. A person with dementia can look like just about anyone else attending the talk. There is no face that is unique to people with dementia, and they should be respected as an individual, and we should not discriminate people with dementia.